Hello, I'm Brian Haug, President of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. Medicare beneficiaries will soon have access to the National Diabetes Prevention Program under a policy change announced by Health and Human Services Secretary Sylvia Matthews-Burwell. The announcement was given after a pilot study run with the YMCA found that Medicare saved $26.50 for every participant over 15 months, and those who finished the program lost nearly 5% of their weight. An expert familiar with the decision believes commercial payers who take in Medicare Advantage will eventually expand this evidence-based program to younger consumers. Michael Payne, Chief Commercial Officer of Omada Health, which provides diabetes prevention programs in digital formats, said that offering the NDPP to those with prediabetes offers a return on investment not always seen in broad-based wellness programs. Said Payne, "Those with prediabetes have reached a tipping point where they may need more of a clinical intervention." Payne will take part in our panel on digital health this week at PatientCentered Diabetes Care, which starts Thursday in Teaneck, New Jersey. For information and to register, visit ajmc.com. Starting today, the nation's cardiologists are gathered in Chicago for the 65th Scientific Session of the American College of Cardiology. This year's meeting focuses on prevention of heart attacks and strokes through behavioral change, as well as advances in population health. The need for stronger prevention efforts became clear when ACC released data from the Cleveland Clinic, which showed that heart attack patients at this world-famous hospital had become younger, fatter, and sicker over the 20-year period from 1995 to 2014. We'll have full conference coverage from the meeting, which you can follow at ajmc.com as well as Twitter. We hear from scientists about breakthroughs in immunotherapy, but what do patients think? Two-time cancer survivor Deborah Madden offers this perspective in her essay, The Promise of Cancer Immunotherapy, Why Patient Education is Critical. Because patients do not respond to immunotherapy the same way they do to older cancer drugs, Madden said it is essential for patients to know what to expect and how to understand that these new therapies are not for everyone. Madden's essay, which is the first of two parts, now appears on ajmc.com. High-deductible plans offer a way for patients to pay lower premiums, but do patients really know how to use them effectively? Robin Wright King of Blue Cross Blue Shield of Massachusetts told AJMC recently that research shows patients can be confused by all the elements they face.
So you've got your health plan, you've got deductibles, you've got co-pays, you've got your your pharmacy piece of your account, perhaps you've got pharmacy deductibles. We offer our members tools to help them find the appropriate doctor, find the appropriate facility, and tools to help them make the best decisions around their health plan. But often members see these pieces as separate pieces and they don't quite know how to pull it all together and use this information in a way that helps them to make better decisions for themselves and their families. So our response to that is to take these tools and resources, integrate them more fully into the health plan, educate members on how to use these tools and resources so, again, they can make better and more informed decisions for themselves and their families.
Thanks to the Affordable Care Act, more Americans have access to mental health care. Figuring out how to integrate behavioral health into the rest of the system is the job of the Accountable Care Organization. Dr. Roger Cathall of Cartesian Solutions will discuss this topic later this month in Scottsdale, Arizona, when AJMC presents its spring meeting of the ACO and Emerging Healthcare Delivery Coalition. There's still time to register and join us. For more information, visit ajmc.com. For all of us here at the Managed Markets News Network, I'm Brian Haug. Thanks for joining us.